Hello everyone, welcome to Dr. Kim's Dental Radiology channel. In this video, we're going to discuss the benefits of taking cone beam CT for endodontic cases. So take a look at this periapical radiograph of tooth number 27 and 28. So hypothetically, let's say this tooth number 28 needs a root canal therapy, root canal treatment. So in that case, how would you assess the overall root morphology or the pulpal morphology of number 28? Before answering that, I want you to take a look at number 27 as well as number 26. When we are evaluating for root canal therapy, we want to first assess the overall root outline as well as the pulpal morphology. And to do that, we try to follow the PDL space along with the adjacent lamina dura as best as we can, and we want to make sure that there's no abnormal dilaceration or bifurcation of the roots and such. In this case, as we expect, looks like it's nice and linear, straight, with no significant bending of the root, and even the pulpal chamber and the canal is relatively linear and straight with no significant calcification. So that's what we want to see. And as expected, number 27, we see similar finding. Nice and smooth root outline of the canine, and the pulpal chamber and the pulpal canal is visualized. That's as far as we can tell, that's pretty straight. Now we come over to number 27 and try to I'm going to adjust the contrast for you just a little bit. Try to outline the PDL space or the lamina dura. How would you have traced the outline? Would you follow this outline? Would you follow the other line, the other outline that we see? It appears we may have multiple PDL spaces here. So based on that, how would you even assess the overall root morphology of this tooth? Even the pulpal space right about here starts as a single chamber, and then as we expect to taper, we start to lose the definitive outline of the pulpal space right about here, right? So it's very difficult to determine what's going on. So how would you assess? Well, we know from our experience, typically speaking, number 28 being the mandibular first premolar, we expect a single canal. But in this case, looks like based on multiple PDL spaces that we see, this tooth may have a bifurcation of the roots and accordingly bifurcation of the canal. But even if we can tell that, it's really difficult to know whether it's two roots are bifurcated mesiodistally or buccolingually, and other than that, we really can't say much about this root morphology, let alone how many canals that you have, right? If we could suspect that if this bifurcates into two roots, perhaps the two canals would be appropriate, would be our guess. But who knows, right? So now I'm going to show you cone beam CT scan of this tooth. Keep in mind this cone beam CT was taken a few weeks after the periapical radiograph series that I showed you earlier, so we do have a couple more teeth that are missing that was previously captured on our full mouth series x-ray. The tooth that we are looking at is again number 28, that is located just distal to number 27. So I'm going to put my crosshairs, first of all, number 27, and zoom in on the tooth to verify what we saw previously. So on periapical radiograph, we saw that the root was nice and straight with no dilaceration of the root or the canal, and that's what we see in this corrected coronal view. Likewise, in this axial view, yes, the tooth is a little rotated, but if you pay attention to the pulpal chamber, once again, it's nice and straight. Even in this sagittal view or corrected sagittal, you can also call this cross-sectional view. Again, we see a beautiful outline of the pulpal chamber and then the canal. Let me remove the crosshair. There you go, right? And it curves it just slightly toward the buccal, looks like. It exits a little bit before the radiographic root apex. So that's great, right? So now, number 26. Okay, let's take a look at number 26. No surprise there, just like what we saw beforehand. Nice and linear canal and the root. No dilaceration in all three different planes, right? And you can actually see the patency of the canal all the way to the apex. Look at this root. Okay, that's number 26. You can again see the root outline and the pulpal chamber and the canal all the way to the apex. Now let's turn our attention to number 28. I'm going to be rotating this a little bit so that we can have a better appreciation of what's really going on. Okay, so why don't we start out with the axial view? Right here, I'm going to maximize this screen. And this is the number 28. So starting with the crown, moving apically. Right here, we see the loss of the enamel layer, meaning we're at about the level of CJ, and moving toward the apex. Still single canal. And right here, what do you see? We are starting to see bifurcation of the root, one mesial root, and then the distal root. The distal root is a lot longer buccolingually than the mesial root. Not only that, as I go toward apically, I hope you can see that the distal root has how many canals? 2 canals. Distal buccal and distal lingual canal. So distal root has 2 canals and the mesial root has 1 single canal. Let me go back up. Okay, crown, CJ, bifurcation of the root into 2 roots and having 3 root canals. Okay, 1, 2, 3. Let's take a look at that in other views. So how about this view right here? Let's go to the buccal end of the scan and then move toward the lingual. Wow, look at that. We can see the bifurcation of the roots and then the canal and also rather severe S-shaped curvature to this mesial root. And it's a little bulbous at the apex of the distal root as well. So there's the distal lingual canal and distal buccal canal and then the mesial canal. It's impressive what we can see in Chromium CT, right? And now let's take a look at this cross-sectional view. Let's see, am I going mesial? I presume so, because this looks like it's canine. So let me go to distal. Go to distally. So here we go. Must be mesial. Wait, that must be distal then. And then this is the mesial. So there's mesial and distal. It's a little hard to see because there's a curvature of the root. It's hard to capture the entire root in a single plane. So I think the most telling image is here in this view, as well as the axial view, right? Let me see, does the 3D rendering show much? Well, it does show that we do have bifurcation of the roots. You can kind of see, right? Let me change the threshold to remove part of the bone. And there you go. Very impressive, right? The technology of cone beam is so impressive. And again, if you had to do a root canal, right, perform the root canal on this tooth, wouldn't you want to know that you're dealing with this? Instead of having to determine that when you go into the access and realizing then that it bifurcates and still not sure whether it has 2 canals or 3 canals, right? So if you accidentally miss a single canal, then the prognosis of having a successful surgical outcome is now compromised, right? So you can see how important it is to take cone beam CT before doing a root canal, especially on a tooth with a possibility for root and pulpal canal variations. All right, that's the end of the video. I hope you found this informative and enjoyable. If you liked the video, please smash that like button and please subscribe, as I'll continue to upload scans or videos 3 times a week, Monday, Wednesday, and Friday. Thank you very much for your attention, and I'll see you in the next video.